is a groundbreaking event. This is the first walk of its kind in the country, and Sandy tells me there's going to be several others going on. First of all, a round of applause to you and your dogs for doing this walk. 75% of my caseload are dogs or cats with cancer. They're either referred without a diagnosis, and I diagnose cancer, or they're referred because they have cancer, and I work with their people, their family, to try to figure out how best to treat them. It's staggering to think that 1 out of every 4 of these amazing 4-legged family members that we see here are going to have cancer one day.
Yes. Okay, wait. Let's go get our water.
Well, I said to Chris's mom, why is Chris's side shaved? His hair's just growing in. Well, it turns out he's got a tumor on the base of his heart that's producing fluid in his chest cavity. So I've seen several dogs here that are already afflicted with cancer. Cancer is such an important issue, and if your dog has cancer, it will challenge you to make some of the toughest decisions you're ever going to have to make, probably in your entire life. And for that reason, in this book, I've devoted a whole chapter called to when the diagnosis is cancer, because the decisions that we poor humans have to make on behalf of our beloved dogs and cats is, how far do you go to diagnose the cancer? Should you treat the cancer? We all have had friends and loved ones that have been ravaged by various types of cancer treatments. Fortunately, dogs and cats go through it much more gracefully without all the side effects that we humans tend to develop. So I'm sure Dr. Kent will be able to answer some of your questions about that. We veterinarians are doubly blessed. We have our patients, which are typically quite straightforward, and we practice medicine on our patients. And then we have what I'm going to refer to in this talk as our clients. That's you at the other end of the leash. And you clients are a little bit more complicated. With our patients, we practice medicine, and with our clients, we get to practice a little social work, a little psychotherapy. We even get to do financial planning with our clients. And what we're learning, it's evolving in a monumental pace, is that the expectations clients have of us in terms of providing veterinary services is vastly, vastly different than it was even just 10 years ago. And so I'm going to talk about the way that some of client expectations are changing. And all of these expectations I'm going to talk about are completely reasonable expectations. It's something that each and every one of you should realistically expect from the provider of veterinary care for your dog.
My name is Monique Zor, and we are Team Bodilicious. We are here to honor our belated dog, the love of my life, Bodie, who just passed away on January 22nd of a really super aggressive cancer. We found out and had a little bit less than 2.5 weeks with him from when we found out. So we're lucky that we had him in our lives. We're lucky that it was a quick trip.
I lost a dog about 2 years ago, a greyhound named Fire, and several years prior I also lost another greyhound to bone cancer.
I'm sorry.
Yeah.
Hopefully we will have a cure soon.
Yeah. Have another dog after Mom passed away. My kids really wanted a dog.
Walking for them, Angel's too soon. They're both Roddy and a Roddy mix. I lost them both to osteosarcoma, and they both had different types of treatment. I did chemo, I did radiation, we did the amputation, and there just needs to be a cure.